You're
Hi.
fine.
Oh, that's good. Well, I have checked several works, several whole works, and I would like to comment some tasks. First of all, it's a task because there are several errors and it's worth to be commented. Let's see. This is the first. Yeah. So this one. For example, for the first one. So, air travel get or is air travel getting increasingly safe? So, now you must see also. Well, so basically here which variant is correct? Because I have here a lot of mistakes in the first one.
Hello, what
Usually
we are
goes.
today?
Number 4, yeah? This number 4. Because no, we will not check everything because I have checked it, but only the sentences which had a lot of mistakes. So first of all, which variant in the first one is correct and why? Let's see. Who wants to answer the question which one is correct and why? Well,
is air travel getting increasingly safe?
Yeah, is air travel getting? That's correct. So basically, a lot of people could have put does air travel get. Why do we need to put here continuous and not simple? Because many people have put present simple. Well, so we have here increasingly safe. And this is the process of getting increasingly safe. So the air travel from time to time, yeah, it is developing and it is getting increasingly safe. That is why we put here present continuous. Okay, another one is number 7. So, number 7, you always come or you're always coming up with excuses for not having done your homework. It's so annoying. So, which variant here is correct and why? Let me see. Anastasia, how do you think? Which variant here is correct and why?
No, always it's present. Just present.
Yeah. But we have here, it's so...
we have not having done because maybe it's in that time and you always coming up with excuses for not having done your homework. It's so annoying. Continuous.
Yeah, you're always coming. Continuous. Why do you put continuous here?
Because we have here that in that moment, that person always not having done his homework that it was before, and that's why in that time it was present continuous. It was not just present, it was continuous tense. I think so.
No, the correct answer here is you're right, it's present continuous, but it's present continuous because it is annoying. When something is annoying, so with the word always, we use present continuous. That is the rule.
Was annoying? Yeah.
It's always. When something is annoying us, and we have the word always in the sentence, so we must use the continuous time. Okay. Also, 9th one. So the 9th, the train in Thursday or on Saturdays. What time do we put here and why? let me see. Okay, Angela. Are you here?
Yeah, I'm sorry. I think problem.
It's
I
9.
have chosen is stopping.
Is stopping. Okay. Why do you think it's stopping?
On Saturday. Maybe because it's plan.
No, if it's planned action and it's habitual action, you see, on Saturdays. So it happens all Saturdays, from Saturday to Saturday. It's repeated habitual actions. That is why we need to put does stop.
Thank you.
Okay. Well, and also, last, C1. Here, I would like to put your attention to third one, for example. So, they on holiday to Spain and won't be back until the end of the month. So, what do we need to put here and why? Ruslan?
In my opinion, we should put here they will go on holiday and will not be back until the end of the month, because in the second part of the sentence we have will not future simple, and so in first part also must be future simple without any no.
No. Okay, so let's remember several things.
Or maybe they може має бути дія, як вони збираються, they're going on holiday, чи ні?
Let me remember you several things. So we have gone to and have been to. The difference between have gone to and have been to consists in the next. If we say she has gone to the office, that means that she has not come back yet. She's still in the office. But if I say she has been to Rome twice, this means that she has visited Rome twice, and he or she is not here now. He came back. Yeah, he has come back. So in this case, let me come back here. You see that she hasn't come back. So in the third one, what do we need to put?
Have been going?
No, they have gone.
Have gone. Have gone.
On holiday to Spain, and they are still there.
So which time is it? How is
It's
name?
present perfect.
Present perfect. Okay. Thank you. I understand.
Well, one more time about this one, yeah? So the difference about here, have gone to and have been to is that if we say have or has gone to, means that somebody hasn't still come back. Yeah, if we speak or if we use have been to, it means that we or the person about who we are speaking to it has come back. That is the difference. Okay.
Okay.
Let's come back and here number 6. And okay, Natalia. So which variant must be here correct and why? Natalia, Okina, are you here?
Excuse me, I forgot to microphone. I have tried to get touch with Jenny all morning, but I cannot find her.
Okay, we have here the word all morning. This must make us understand that this is a large action for us. If it's a large action, so we must show it somehow. In what way can we show that this action is large? Because for us, all morning must be a lot of time.
I have been trying. I have been.
Yeah, that's right. I have been trying to get in touch. Well, and the last one will be number 7. And okay, okay, I have 2 Angela. Is this the same person, or are
no.
they?
No, it's the same person. I am the same person, only I have to compute with good monitor
Okay.
and very small.
Okay,
Small is good sound, but big is good monitor. I don't finish the book yet, so I can tell you that happens. I write about don't finish, but now I think maybe it's present continuous.
No. First of all, we have yet. Yet can give us a key of understanding that what kind of times do we need to put with yet, generally.
It's
Present
perfect.
Perfect group, generally. It's the perfect.
It's perfect.
Yeah. Okay. I wanted just to show you some time expressions here, but okay. You were right. It's perfect group. So, what kind of answer must we have here?
I have not finished.
Haven't finished. Yeah, correct. The same plus minus. Are there any more questions regarding the homework? No, there are no questions. Okay, perfect. So still we will have at home a bit more practice with it, but for now, today we will go on speaking, better to say, about compliance. It's our last lesson about compliance. Last time you asked me about the abbreviation, so this homework will contain common medical abbreviations. There is a list of medical abbreviations. It's just you see, if you need to do some of them in your daily practice, you just have a look and learn by heart those which are more commonly used by your area, or just have a look, because the list is quite large, but at least it's like you have the abbreviation you need to. This is the first information you need to. So first we will go on with clinical information that generally you are getting from your clients, but also when you are on the consult and you are speaking to your patient, sometimes your patients have their own body language, and this body language also can help you to understand what is happening to the patient. So here in the pictures, you will find different gestures, and you need to find a picture and match to the description of body language. You see here the description of the body language. Like, for example, A means that the doctor is not sure about what he's saying. Yeah. Okay. Or also A, B, and C can also express that the patient is not comfortable or at ease. You see, B and C. Well, let's go on. We have still a lot of information here, like patient is angry. How do you see? How do you think? Where is the patient is angry? In which I will just download it in order to not need to zoom it all the time. In which photo, better say?
Photo A.
Okay.
And also maybe photo B, picture B.
Picture B. Perfect. Let's see.
So B or A?
B
Or
and
this both?
yeah, they can be both of them. As you see, in the
Okay.
second part, we had 2 of them, and that's good. Okay, I will open it in more comfortable way. Well, let's go on. And the doctor is bored and enthusiastic. Where is it? What picture is this?
Maybe C.
Okay, yeah, it can be C.
And it also, I think, can be picture A.
Yeah. Well, so all depends also on the actions which go further. Well, next one, number 5. Let me see. Irina, how do you think? What is number 5?
The doctor is showing interest and inviting the patient to continue speaking. I don't see pictures. Oh, yes. Picture B.
Okay. Let's go on. And well, Olha.
The patient doesn't understand what the doctor is saying. I think it's B.
Okay, can be B.
It can be.
Okay, and also I think it can be C. Yeah.
C.
Yeah, can be
I
B.
thought about both B and C.
Well, let's go on. And now next one for Irina.
The doctor and patient attend communicating.
Continue.
Communicating. Number C.
Aren't communicating C. Number C and maybe number and A. Yeah.
Yes. No. Maybe.
Oh, letter. It's not number. It's letter. Okay. What the body language in exercise 1 would mean if you in our own culture? So if the doctor is not sure about what he's saying, what gesture or body language will you as a doctor do? So are there any proper body language for our Ukrainian culture? Or have you maybe noticed it while consulting patients? Who wants?
May I try?
Of course.
I think body language is very important in communication with patients.
Have you noticed some body language while treating patients?
For example, how it's very important how a doctor to talk to patients, how explain talk to patients, how he or she explains his empathy. Yes. And if it's good way, if he or she do it in good does in good way, depends also result of examination of diagnosis and in future treatment.
Okay. Well, does anyone who want to add something? No, nobody wants to add something. Okay. Well, if we speak about these gestures that we had here about understanding, not understanding, interest, boring, angry, what kind of emotions do you face while consulting the patients? Anastasia, for example, you in your consultations, what kind of emotions of the patient do you face too? Anastasia, are you here?
Oh, I'm sorry. I'm talking and my microphone is off. For me, it's kindness, it's empathy, it's trying to understand the patient, his side, and to make a connection with the patient, because it's very important when the patient trusts you, your treatment will be better, and when you have this connection with patient, it's bad, I think, in our profession.
What are the common emotions, patients' common emotions, which you are having almost all the days while consulting people?
Is their emotion or my emotion?
Patients' emotions.
It's pain, it's always negatives, розчарування, disappointment.
Yeah, the patient
Yes,
can be
the negatives, it can be disappointment, disappointed. Sometimes they are angry, desperate. Sometimes it when we have the difficult.
Okay. Are there any moments when patient is coming to your consult and you just have a look to his or her face and you understand what kind of emotion does the patient have?
Yeah, sometimes when it's opens the door and coming in, I see what I need to do and what I need to say, or just not to thank, or just listening to the patient.
Okay, I understand. Thank you for your answer. Do anybody wants to add something about it? Some more comments? Okay. Well, so generally you see that in all cultures there are some body language gestures which generally are common for this country, and of course they are just basic gestures and emotions which you can have on also while you consult. Okay. Decide what body language would you see, well, don't you want to have in your consult, better to say like this. So what are the best and the worst emotions which you can have while you consult with the patient? Ruslan?
Could you please repeat the question?
Okay. Are there any emotions which you wouldn't have during your consult, speaking with the patient?
Some emotions which I wouldn't have.
Wouldn't like to have.
I wouldn't like to have.
During the.
So speaking about the consultations, it's very often there are situations which happens very often when patient just want to tell you about all his or her life and life problems, and the some situations which happen in their during their day, but not to tell about the disease which maybe disturb them. And I don't know how to name this this emotion or type of speaking. Maybe is just накопичена втома людей.
So it's a fatigue.
Is
Yeah,
a fatigue. And of course, we need to listen people, but to be honest, not always we want to do, or I want to do it, but it's life. So
yeah,
alright.
I understand that patient sometimes wants some sympathy to them, and they tell it, but I also understand that it can cause this fatigation, and of course, if all the patients spoke about their emotions while they consult, there would be no any doctor who would like to work with them. Okay, they also here ask you to find some information in the internet about these 3 points. Yeah, if are there any fields besides medicine where understanding nonverbal communication is important? What a patient-central approach in history talking means, and what is Calgary-Cambridge method is. Let's speak about the first one, about nonverbal communication. So how do you think, in what areas are nonverbal communication is nonverbal communication important, and why? Anastasia?
I'm sorry, but I don't understand. We have to see something on the screen.
Don't you see the presentation?
I see the past task. The doctor is not sure about this cartoons and
yeah, but in number 3, you see here?
Number 3. Okay, one moment. I need to push it.
So in which fields of medicine do you think nonverbal communication is important, and why?
Nonverbal to
Nonverbal means that you don't speak, yeah? It's they are gestures or body language.
I just don't understand the question.
So in which area of life, not besides the medicine, is nonverbal communication important? How do you think? Where do we use nonverbal communication?
Anywhere, I think. No?
For example, can you give some example of it?
Maybe, you know, when you go to the supermarket and the cashier, cashier буде на...
Cashier, yeah, and
the cashier is sitting there and he is angry and his face is angry, and sometimes if he said to you not very good,
if he says you, not something bad,
just look at you,
looks at
the way you not like. I think in all spheres we need to communications, and sometimes our face to show more than when you are not talking. That's why I don't know. Maybe when you don't see the humans, then when we are talking on the telephone, maybe then when you don't see the person. It
Yeah, it's
cannot
quite
make so
strange, but
sense.
yeah, it's quite strange, but what you're saying about if you're not seeing the person, it's strange. But even if we don't see the person, we feel when the person is smiling. It's a strange fact. But okay, any other ideas about where do we use non-verbal communication? Who wants to say? Where is it important? For example, when I'm explaining something, I can use gestures, yeah, to show something. So in my area of teaching, it's important. Where more in what more areas of life do we use nonverbal communication? Olga, what do you think about nonverbal communication? Where can be used nonverbal communication more?
Maybe it's for actors and actress.
Of course, yeah.
It's very important.
Yeah, so acting, teaching.
Maybe more than verbal communication.
Of course, yeah. And sometimes that is why a new kind of theaters have appeared. Yeah, like shadow theater and so on and so on.
Yeah, something like that. Yes.
Okay, but also it can be concealing or showing or buying or selling. Yeah, because it's just we can show something in order to say that we don't want somebody to ask us something, yeah, or something like this. Well, if we speak about what a patient-centered approach in history talking means, so what is this patient-centered approach and what does it mean in a history? Tatiana.
I'm sorry, I just joined into meeting. I was on my way.
Doesn't
We
matter.
don't understand.
Yeah, we just are thinking about these 3 points. Yeah, the second point is what a patient-centered approach in history talking means. So what does it mean, the patient-centered approach? What kind of approach is this one?
Approach, what is approach?
Approach підхід. So patient-centered approach – це підхід, який центрує свою увагу на пацієнта. Пацієнтоорієнтований підхід.
Little bit don't understand.
Okay. Any ideas about patient-centered approach? What kind of approach is this while consulting patients?
Maybe it means what patients is every patient is VIP, may I say like VIP, and everything around patients. So attention, his attitude and everything. I think this is.
Yeah, so it means that the doctor needs to deal with the patients as a person rather just the illness. Yeah, giving them the opportunity to speak, make decisions about their treatment, and also taking into account patients' body language, patients' mood, and not just illness. Yeah. Well, and here the third one is more interesting. And let's see, what is the Calgary-Cambridge method? Have you heard about this method? Maybe somebody have heard?
Yes.
Okay, so what kind of method is this?
It's a method how to build communication with patients. It
Mhm.
means, for example, how begins to talking, how to receive information, how to build relation, but how relaxed. Yes, no, maybe build relation. Yes, and in future, no, plan and take decision,
Of
which is good for, no, not good, good for patients and for doctor.
Of course. Perfect. Yeah, there are several tools which you have noticed. That's good. Well, let's go on. We will also see here a case report, which is related to the audio we have listened. This is the extract from this case report written by Dr. Martin after the consultation with Mr. Wood. You need to insert the words in the correct form into the appropriate blank space. Let's see. We have here several words like present, have, be, smoke, also one more time, be, work, and radiate. Let's start. All right. Let's see. Angela, start, please.
A 49-year-old man presented in A&E with a chest pain. He had had the pain for 3 hours prior to arrival. The pain was in the center of his chest and radiated to his left shoulder.
Thank you. Okay. Anastasia.
He has a history of chest pain on exercise, which
He
has
had.
been he had a history of chest pain on exercise, which has been present for the previous 6 months.
Thank you. Okay. Tatiana.
He smoked approximately 20 cigarettes a day and teetotal and was teetotal.
Okay.
He has been prescribed aspirin, B blockers for the previous 2 years, and a GTN spray to use as required, which is 2 to 3 times per week. His father died of a myocardial infarction, age 65. He has an allergy as a gallery attendant.
No. He worked.
Works.
Sorry. He worked as a gallery attendant.
Worked.
Yeah. The past.
Okay.
Past,
Sorry.
Yeah,
Yes.
because we almost all the text is you see here is in the past. There is
He
no one.
worked.
Yeah.
Gallery
Well,
attendant.
so you see here the clericing note which cleric has took, and well, complete this clericing from these notes. This will be the homework. So using these notes, you will need to also write down the report, a case report about the patient, this patient. Well, and let's go on. We will speak about abbreviation today, as you have understood. And these notes show the doctor's findings when he examined Mr. Hall or other patient. Let's have a look to these notes and note that explanation given for the abbreviation are used. So what do the other RINS abbreviation stand for? Let's see. So we have here surname, first name, age, sex, marital status, occupation, present, compliant. And let's see, what is OE?
On examination.
Okay, we see general condition. See ear, nose, throat. Yeah, we see nothing abnormal detected. NED. What is RS?
Respiratory system, maybe.
Okay, perfect. Let's go on. Then we see here CVS. What is it?
Cardiovascular system.
Perfect. We see here also regular. And what is BP?
Blood pressure. Blood pressure.
Blood pressure, perfect. Let's go on, and we see also gastrointestinal system. What is GUS?
Genitourinary system.
Perfect. And what is CNS?
Central nervous system.
Nervous system, perfect. Well, and you see here also immediate past history, points of notes, investigations, and urine VE. What is VE?
Maybe negative.
Okay,
What?
vaginal examination. VE is vaginal examination.
Examination.
Also, we have here diagnosis, management, and hypertension. C. Well, so having looked here, what does the ringed abbreviation stand for? We have seen, and let's see. We have here a letter from a general practice toy consultant. We will see now the letter, and we will need to make questions which doctor might ask to obtain the information linked to this letter. So, for example, how long did it last? Or what was the cause of the death? So, let's see. You can see the letter yourself, and I'll give you some minutes in order to make questions. As you see, there must be like 8 questions regarding the marked point. I'll make it not so big. So 2-3 minutes, and we will see these 8 questions. Okay. Let's start checking our questions. So the first question, Natalia.
What is main occupation? This man is salesman.
Yeah. What's your main occupation? If we speak about the question which the doctor has put to his patient. Yeah. Okay. Let's go on. The second one, and Irina.
Have you pain? And where is this pain?
Located. Yeah, where is the pain located?
Yes.
Okay, Ruslan. Number 3.
When does it come? Or when does it, or when it was happened?
When has, okay, when did it happen? Because we are interested in the exact time.
Yes,
Yes.
when did it happen?
And we have the 6 months ago.
Yes.
Okay. Angela. Number 4.
5, yeah.
Go for it.
Did anything relieve the pain?
Okay, we are interested here in the result of the previous action, so we must use another time. It's first of all, and secondly, you need to do the fourth one. Lasted 10 minutes.
4. How long lasted pain?
Okay, so how long make you understand that it must be continuous action?
How long have been lasting pain?
Have how long has been
lasting pain?
Oh, has the pain been lasting? We want to put the word pain. Okay. Well, and the fifth one, the correct answer, Anastasia.
Relieved by rest. What did relieve the pain?
In what we are interested also in the result of the action. Yeah, we don't ask where.
What have relieved the pain?
What have relieved or has relieved the pain?
Past or present?
It's present, but perfect.
Present.
Yeah, but what is the third person? So what has relieved the pain?
Can we ask, have anything relieved the pain?
Has anything, yeah. Has anything
Have
relieved?
anything relieved the pain?
Yeah, but has, not have.
Had
You want, but okay.
present perfect.
If we had, first of all, past perfect, we must use
Past
like
perfect.
you just told me past perfect form. Yeah. So if you use past perfect, in the reality, it must be an action previous to another past action. But we are here interested in the result of the action for now. We are not interested when did it take place or what happened there. We are interested in the result. That is why we use present perfect. So the correct question, what, just a second, what has relieved your pain?
What has relieved?
Or either has anything relieved your pain? Because you wanted it with anything, yeah?
I told have in present perfect.
Has anything?
Has, just not have.
Has anything, because anything is third person. Has anything relieved your pain?
Yeah,
Mhm.
because pain, це ж третя особа.
Yeah, the
Mhm.
third person. That's it. Okay, singular. Well, let's go on, Tatiana.
Yeah.
Next one.
This has recurred several times after exertion. How did you feel after? No. Stop. How did you feel after exertion?
Okay. Oh, when
Or how it was after exertion?
well, okay. How did you feel after exertion?
Or
Oh, how has you felt? Okay. How has you felt after exertion? Or yeah.
did you feel any pain after exertion?
Perfect. Did you feel any pain? But if we are asking about the result, so better have you felt any pain after exertion? Yeah, because we are here more centered in the result of the action.
Have you felt?
Have you felt any relief after exertion? Okay.
Okay.
7. And who is iPhone? Because I have
Maybe it's me, but I
yeah, it's you, but
Oля.
I have Ola. Okay, another Ola. Perfect.
Died age 36. When did he die?
Yeah, that's right.
Past simple, yeah? Just
Yeah, because we are interested in the exact time in the past.
when.
Okay. That's good. And let's go on, Natalia.
What the diseases of your relatives, father, mother?
No, we have here coronary thrombosis. So
What the cause of died? What the cause of death?
death, yeah. Or what has caused the death? Yeah.
What? Can you repeat? What?
What has caused
Ah,
the
caused.
death?
Яка причина смерті?
Okay. Yeah. Or what was the cause of death? Also, cause like can be also like a noun. Okay, that's good. These could be the questions put to the patient. Let's go on. And the hospital consultant made these notes of the interview with Mr. Green. It must be the same Mr. Green. Yeah, Green and Peter. So you need to complete as many of the gaps as you can with the help of the letter. And this letter, this previous letter, yeah, here. Completing in such a way the notes, the medical notes. Then you will need to listen to the recording and complete the remaining gaps. Use the abbreviation you have studied here in this unit. So let's see. If you need, you just go same as that you need to go back, and I will put another page. Here you need to complete this information and this info, this note about him. So as you hear here, there are 7 gaps, or 9 gaps. You can put them in your copybooks. Like 2 minutes, 2 or 3 minutes to writing it down, and let's listen. If you need this page, so it is here. If you need the copy, I can send the copy of this page to Telegram in order to have a look and not open the class. And I will center only here. Okay, so let's listen the rest of the information in order for you to fulfill all these blanks. Just a second. We will listen it twice.
Unit 1, Task 8.
Come in, Mr. Green.
Yeah.
Come and sit down here. I've had a letter from your doctor, and she tells me that you've been having pain in your chest.
Yes, and in my arm, and also tingling in my fingers. And
Yes. Now, when did you first notice this pain?
Well, I suppose about 6 months ago.
And can you remember when it first came on?
Yes, well, I remember I got a bad pain in my chest when I was shopping. It was so bad I couldn't breathe. And
Where? In which part of your chest did you feel the pain?
well, right across my chest.
And how long did it last?
About 10 minutes.
And what did you do when it happened?
Well, I just stop and wait for it to go away.
So, have you had the pain again since then?
Yes, I often get it when I overdo things, and
I think at this stage I'd like to examine your chest. So, if you could strip to your waist.
Right. There we are.
That's fine. Fine. I'll just check your pulse first of all. Fine. That's fine. It's quite normal. 70 per minute.
Right.
Now your blood pressure. Fine. That's quite normal too. 130 over 80.
Oh, I'm pleased to hear it.
Now, I'm going to listen to your heart. So I want you to breathe normally. Your heart sounds quite normal.
Well, that's a relief.
Well, now I want you to take deep breaths in and out while I check your lungs. In. Out. In. Out. Fine. They're completely clear. Well, Mr. Green, the pain you've been having sounds very much like the pain of what we call angina. And this, this occurs when not enough oxygen is getting to the heart. Now, I'd like to check a few tests, and following that, I'll be able to advise some treatment for you.
Okay. Is it enough, or do we need to listen it one more time? Is it enough?
Maybe one more.
Okay, one more time. Let's listen it this second time, and as you see, the abbreviation will help you in order to complete it, because you don't have a lot of time. And I thought, why is it?
And may I ask a question?
Of course.
Patients told or about pain right across my chest. What is translation? Right
Across.
across my chest. I understand every word, but
So let's
meaning,
translate.
it's right. I don't know.
Правої сторони.
Прямо з правої сторони чи прямо через всю, яке значення? З правої буде йти right.
Ні, across це через усю грудну
Клітку.
Права через всю
Клітину.
грудну клітину. Мгм.
Тому що right це не завжди прямо, ну, прямо, да? Like, you are right also can be, ти правий, да? Тобто воно повністю через усю грудну клітину.
Мгм. Дякую. Thank you.
For nothing. Let's listen the second time and then let's check. Okay, let's download it.
Unit 1, Task 8.
Come in, Mr. Green. Come and sit down here. I've had a letter from your doctor, and she tells me that you've been having pain in your chest.
Yes, and in my arm, and also tingling in my fingers. And
Yes. Now, when did you first notice this pain?
Well, I suppose about 6 months ago.
And can you remember when it first came on?
Yes, well, I remember I got a bad pain in my chest when I was shopping. It was so bad I couldn't breathe. And
Where? In which part of your chest did you feel the pain?
well, right across my chest.
And how long did it last?
Ooh, about 10 minutes.
And what did you do when it happened?
Well, I just stop and wait for it to go away.
So, have you had this, the pain, again since then?
Yes, I often get it when I overdo things, and
I think at this stage I'd like to examine you, your chest. So, if you could strip to your waist.
Right. There we are.
That's fine. Fine. I'll just check your pulse first of all. Fine. That's fine. It's quite normal. 70 per minute.
Right.
Now your blood pressure. Fine. That's quite normal too. 130 over 80.
Oh, I'm pleased to hear it.
Now, I'm going to listen to your heart. So I want you to breathe normally. Your heart sounds quite normal.
Well, that's a relief.
Well, now I want you to take deep breaths in and out while I check your lungs. In. Out. In. Out. Fine. They're completely clear. Well, Mr. Green, the pain you've been having sounds very much like the pain of what we call angina. And this, this occurs when not enough oxygen is getting to the heart. Now, I'd like to check a few tests, and following that, I'll be able to advise some treatment for you.
Okay. Well, let's see. So some of them you could have seen in the seventh task, but some of them no. Let's just check everything we have. Well, so Olga, start please reading these notes.
Start with the surname.
Yeah, surname is Peter.
Mr. Green.
Yeah, Peter Green. Yeah.
First name's Peter. Age. 36. 42.
42.
Yeah, 42. Sex. Male. Marital status. Male. How? It's male.
Married.
What does mean M? Marital status.
Marital status.
Married.
Married.
Yeah. Married, single. Okay. Marriage. Occupation. Salesman.
Okay, thank you. Let's go on. And Anastasia, go on, please.
chest pain,
Radiating to.
Там was chest pain across,
Right.
right across,
the-
pain right across the chest, radiating to left arm, started with severe attack and dyspnea. Pain lasted for 10 minutes, relieved by the rest, has occurred since an exertion.
Okay, let's go on and Ruslan.
Respiratory system, chest engine, cardiovascular system. The doctor said that oxygen no go in heart.
Doesn't
Doesn't.
do the heart.
70 per minute pulse
Mhm.
and 130 on 80 blood pressure.
Mhm.
Normal.
Okay. Well, do we have any more notes for the next, for the rest? Because we have in the picture, we have here also the diagnosis, immediate past history, points of notes. Do we have any more information here?
Diagnosis only in China.
Yeah, only diagnosis. That's it. Well, so as you see, the practitioner has written it in such a way, everything that we heard speaking with the client. And I suppose that you also do it in the same way. Well, the last point that we will have today is about a case history, another case history with Mr. Will de Goose. And we will also try to use this case history. We will trying to find out and underline information about patients' previous occupation, initial symptoms, initial diagnosis, conditions of immediately prior to admission, reasons for emergency admissions, duration of increasing first and nocturia, causes, cause of death, and alcohol consumptions. These are notes which we need to find out in this text. So let's start to read it. And Irina, start, please. I will put it more bigger.
Case history. Mr. Will Goose, a retired bus driver. Retired bus driver was unwell and in bed with a cough and general malaise. When he called in his general practitioner, a lower respiratory tract infection was diagnosed and erythromycin prescribed.
Okay. Well, let's go on. And Angela.
2 days later, at a second home visit, he was found to be a little breathless and complained.
5 хвилин, 4 може.
Yeah, I don't know.
Another 2 days passed and general practitioner returned to find the patient barely rousable and breathless at rest. Was arranged to the ground of severe chest infection. The ward on arrival in the 24 hours. He had been in containment of urine few occasions
Yeah.
during this time. He had been noted to have increased thirst and nocturia for the previous 2 weeks.
Okay, thank you. And the last paragraph, Ruslan, please.
His past history included appendectomy at age 11 years, cervical spondylosis 10 years ago, and hypertension, for which he had been taken a thiazide diuretic for 3 years. His father had died at 62 years of myocardial infarction, and his mother, his wife, kept generally well, but had also had a throat infection the previous week. Mr. Wild Goose drank little alcohol and had stopped smoking 2 years previously.
Okay. It is our last task, so we just answer these questions and I comment the homework and we will finish. Well, Angela, so what is his previous occupation?
Mr. Goose is retired bus driver.
Tatiana, what are initial symptoms?
Initial
Yeah, initial symptoms.
where is it? He had been known to have increased thirst and nocturia for the previous 2 weeks.
Yeah, so only his wife could say something about his well-being, and yeah, he had been incontinent of urine on a few occasions during this time. Let's go back and initial diagnosis. Irina, what is the initial diagnosis?
Respiratory tract infection was diagnosed and erythromycin prescribed.
Okay, perfect. And conditions immediately prior to admission, Tatiana.
On arrival in the ward, he was unable to give any history, but it was certain from his wife that he had been confused and unable to get up for the previous 24 hours.
Yeah, so he had been incontinent of urine, and he had been noted to have increased thirst and nocturia for the previous 2 weeks. These are the conditions. Well, and duration of increased thirst and nocturia, which is the duration, Olga?
Incontinent of urine on a few occasions during this time.
So how much time has he been affected by nocturia?
24 hours.
2 weeks.
Oh, 2 weeks, yes. Sorry.
Previous 2 weeks. Okay. Father's cause of death. Tatiana.
Yes. His father. Let me. His father had died at 62 years of myocardial infarction, and his mother had rheumatoid arthritis.
Okay.
But they just asked about father.
Yeah, about father. That's it. And alcohol consumption. Ruslan.
Mr. Wild Goose drank little alcohol.
That's it. Okay, well, so you will need to write a case report at home, but also you will see here several tasks for present tenses. You see them here. And also you see here the information you need to study the case to make the questions the doctor have asked to obtain the information. Have been acquainted with this abbreviation, and also, as I told you, this information about previous information about this one, point 2. Complete the clerking form for these notes. It was number 2, point 2. That is why it is second time here. Well, are there any questions regarding the homework or regarding some materials that we had today? Something in your material?
One more time, home task.
Yeah, so here, point 2, to complete the clerking form from these notes. Secondly, after the homework, you see here point exercises for the present times. And also after the homework, everything which is the homework, you have it, yeah? But task 9 you make the questions according or basically on these notes. And also you have a look to the more common medical abbreviations, and if you need some of them that you use every day while you practice, so it's recommended to learn them by heart, of course, but the list is too long. At least you have somewhere to check the abbreviation right now. Yeah, this is the complete list of common medical abbreviations. So have a look to them and learn by heart one which are important for your area while your clinical consultations. Are there any more questions?
Це все треба вивчити на пам'ять, так?
Ну, виберіть для себе ті, які ви вживаєте конкретно для вашої сфери найбільше. Ну, і вивчіть ті, які вам потрібні. Тому що тут вони common medical abbreviation, тут їх повний список, да? Відповідно, продивіться просто список очима, щоб ви собі уловили логіку. Як бачите, там, в принципі, абревіації складаються в більшості випадків з приголосних, просто щоб ви собі уловили логіку і виберіть ті, які ви конкретно в вашій сфері вживаєте найбільше. Ну і вивчіть ті, які вам найбільше всього потрібні. Зрозуміло, що вивчити всі буде достатньо багато, бо список достатньо довгий. Але хоча б прогляньте його очима всі і виберіть ті, які вам найпотрібніші, і вивчіть ті, які вам найпотрібніші. Окей.
Дякую.
Понасі. See you.
Thank you.
Дякую.
Thank you.
Bye.
Bye.
Have a nice
Goodbye.
Thank you. Goodbye.
Да.